Hey guys, welcome back to my channel. Today we're talking about shoulder pain and more specifically, rotator cuff dysfunction. My name is Adam, proud father, married to an amazing woman, fitness enthusiast, registered physical therapist. This channel is dedicated to those busy parents trying to figure out how to perform at their best in this crazy game of life. This content is for educational purposes and never intended to replace medical advice. I'm Adam Chang. I'm a registered physical therapist. I've been practicing for roughly 13 years, and over the course of my 13 years of practicing, shoulder pain is something that people often seek physio for. So it's safe to say that I've helped a lot of people who experience shoulder pain. And we know that most people think either it's a frozen shoulder or they have a rotator cuff injury. There are many reasons why people experience shoulder pain, and it can be coming from many different areas of your body or several different root causes. Today we will be discussing specifically rotator cuff dysfunction. Now remember, this information is for educational purposes, and it definitely should not replace any medical attention or advice or even professional advice coming from your therapist. A little background anatomy about the rotator cuff I think is very necessary, because when we start to retrain your rotator cuff, it's important to understand the purpose of the rotator cuff and the mechanics. This will allow you to be a lot more mindful in your exercises to really get the results that you want. So first off, the rotator cuff are four muscles. You have the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Think of the acronym SITS, S-I-T-S. These four muscles originate in the shoulder blade, or the anatomical term would be the scapula. From the scapula, they project outward and insert and attach onto the head of the arm bone, the humerus. They act like fingers that keep that head snug in the socket. So if you think of the shoulder joint as a ball and a socket, or like a golf ball on a tee, that ball has to spin within that socket. That golf ball has to stay on that tee, while the bigger muscles, the more superficial muscles like the deltoid, the pec, the lats, move your arm bone. When we think of the rotator cuff, remember, it's a stabilizing group of muscles. In synergy, they act together to keep that ball in the socket. Often when we look at the range of motion or the movement quality of somebody who is experiencing a rotator cuff dysfunction, we can see trends and patterns. That ball, which is like my fist here, and the socket, which is like my hand, the ball has to spin and stay centralized in the socket while that arm bone elevates. If you're experiencing this pain in your shoulder, let's take a look at how you raise your arm and elevate your arm overhead. Often people will describe not being able to keep their shoulder down. So instead of being able to just raise your arm like this, what you actually see is a hiking of the shoulder. And that hiking up of the shoulder is because that rotator cuff is not active to keep that ball in the socket. So instead, what you get is the translation of the bone upward to the roof of the shoulder. So those fingers aren't keeping it nice and snug. Instead, as the big deltoid muscle that inserts on the arm here, and it starts up here on a bone coming off of the shoulder blade, that deltoid will pull that bone upward. If that rotator cuff is not keeping it snug, you're not going to get that nice glide movement. So usually we see this happening, and this is indicative typically of the supraspinatus rotator cuff muscle being injured. That supraspinatus sits on the top above the spine of the scapula, hence the term supraspinatus. And if we were to isolate this muscle really acts to elevate your arm in isolation from about 10 degrees up to maybe 30, 40 degrees of elevation. But then once we get the arm up higher, that muscle acts in synergy with the other ones to keep that ball in the socket. This is something that we will often see. Now, the other muscles, the subscapularis in isolation rotates that arm bone in, and the infraspinatus and teres minor rotates the arm bone outward. So what's happening is the pull of the muscle is allowing that ball to spin this way and that way. There can be some translation forward and backward with this movement, and excessive translation is indicative of a lazy, injured, or weak rotator cuff muscle. When that translation occurs, forward or backward, then we can get compression, friction, and irritation of other tissues within the shoulder joint itself. This is where we get the bursitis. This is where we get the bicep tendonitis. So you have these other structures that live within the shoulder that will, as a result, get irritated. So how do we correct this problem? We have to be focused on mindful exercises that help to activate and initiate the activation of those rotator cuff muscles. Now, if it's torn and it's acute, then we are mainly focusing on allowing the tissue to heal and getting more range of motion. Once we're in that subacute phase, so more like 2 weeks out, 3 weeks out, then we can start seeing if we can activate those muscles better. Now, if this is a chronic problem that you've been having for a very long time, then we can have free rein to actually get the rotator cuff active. Sometimes, or oftentimes, when one of the rotator cuff tendons is injured, that specific rotator cuff muscle, the actual muscle belly, will become what we call inhibited. So it gets a bit lazy, and it forces the other rotator cuffs to get more dominant and overactive. So then now we have that ball sitting a little forward in the socket. In this case, we have to be very precise with how we treat the shoulder. Are we activating and exercising the right muscles, or are we just dominating? If we just do exercises where we're working against gravity and the shoulder is just doing what it wants to do, we might actually be playing into the problem rather than correcting the movement dysfunction. It's the old saying, practice doesn't actually make perfect. Perfect practice makes perfect. So do not tire out your shoulder while exercising when you have something wrong like this. Instead, do a few repetitions, being cognizant and mindful of how tired your shoulder gets, and take nice long rests between sets. We are focusing on the actual movement quality versus the quantity. Okay, it takes a little finesse and a little tedious. As you move your arm further out, it requires more of a demand on the rotator cuff. So we typically start more in neutral with your arm by your side, and then we start to activate the muscles with your arm moving away from the body. So before jumping into some of these rotator cuff strengthening exercises, it's great to do a little muscle reset. The muscles at the back of the shoulder blade, the posterior cuff, are often pretty tight. So we can get at these muscles using a massage ball or a therapy ball. Get the therapy ball between the wall and your body, or between the floor and your body. Then you can move your body up and down, side to side, roll out some of these knots. It's not going to feel great, or it may feel amazing. It's really individual, but you can get your arm elevating. You get your arm moving across your body, across your chest, rotating it in and out. You will afterwards find yourself with better range of motion and probably less pain. The internal rotator of the 4 is called the subscapularis. To get to that one, you have to slide your thumb into the armpit, the front surface of the shoulder blade. This one can be tricky. You will likely also need some lubrication because it can be uncomfortable. Try to use only 25% of your strength, not too much pressure. After you've reset some of the tone in the muscles, it's time to strengthen. Start in a neutral shoulder position with your arm by your side. Stick a rolled up towel between your arm and the side of your body. This will allow for you to maintain the correct position and not move your arm away from your body when doing the rotations. Take your other hand, your index and your middle finger, and palpate or feel for that arm bone. The purpose of this is to make sure that that arm bone is not pushing into your fingers. This little trick allows you to maintain that ball centralized in the socket where it should be. Remember, focus on the proper movement and the stability of that ball in the socket. Perform both a rotation outward and a rotation inward. Make sure that you have just enough resistance to initiate the activation of the movement, but not too much resistance because it'll be really difficult to maintain stability and it might be painful. Then you can do what we call a full can exercise. Take a very light weight, or maybe even a can of food or a water bottle, and at a 45-degree angle, you're going to raise your arm away from your body with a thumbs up position. Make sure you maintain your shoulder blades together during this movement. The retraction or the pinching of the shoulder blades at the back helps to initiate a better activation of your supraspinatus. I don't like giving a whole whack of exercises to people because to do them right, it actually takes a bit of time and focus. And for the average person, they will become non-compliant if I give them 10 exercises. So I'll give you one exercise for each rotator cuff muscle, and then we can go out and practice them. And I will do a follow-up video. We'll have progressions for those specific muscles. And then in the end, what it looks like is doing compound functional movements because we already strengthened and improved the activation of those little stabilizers. So we start with the deep stabilizers and then we move outward to more compound movements that require multiple muscles working at the same time. If you found this video to be helpful and you like my content, please drop a comment, hit the like button, and subscribe. And please share this with family and friends that you feel could benefit. Till next time, this is Adam Chang signing off.